confirm that it's just been started.
Thank you very much indeed. Welcome to the meeting of the Hampshire Local Outbreak Engagement Board. This meeting is being held remotely and members are in attendance via a video conferencing link. The meeting is being live streamed and will also be available for repeated viewing. I will begin by naming the members who are in attendance for the public record. During the meeting, if any member wishes to speak, they will indicate this to me and I will call them to do so. And I would like to remind members that the Council standing orders continue to apply. In attendance are myself, Councillor Keith Manns, Councillor Liz Fairhurst, Councillor Judith Gruevski, Councillor Patricia Stallard. Can I see Patricia anywhere? No, I don't think she is.
I can see her, Councillor Manns. I think she just may not be on your screen.
You're here.
Yes.
That's
I'm
fine.
here.
Great. I just couldn't. You weren't. And we've also got in attendance the CEO of Hampshire, John Coghlan, Councillor Ken Rattigan, leader of Basingstoke Council. We've also got Simon Bryant, who is the head or director of Public Health, Councillor Keith House, who is the leader of Eastleigh Borough Council. We have Judy Gillow, and we have Laura Taylor. Who have I missed out? Ah, yes, and we've got Graham Allen, who is the director of of Adult Services, and in attendance as well, who I will ask to speak in a minute, is Councillor. Lost you now.
Councillor Porter.
Ah, yeah, there we are. I've got you now. Councillor Jackie Porter, who's going to speak in a minute. Sorry about that, Jackie. I lost you from my screen for some reason. Have I missed anybody out?
No,
Okay.
Chairman, but just for clarity, given the description you used earlier, I'm here in my capacity as county council, not as a borough council leader.
Sorry.
Thanks.
Sorry. Yes. Thank
Given we're broadcasting to the
Thanks.
world.
Thank you, Keith, for that correction. Absolutely right. Have we any apologies for absence? I don't know of any.
We didn't, Councillor Manns. No apologies.
Have any members got any declarations of interests? Okay. Minutes of the last meeting. Have you all seen the minutes of the last meeting, and have you any comments about them? Okay, are you happy for me to sign them? Jackie, have you got a comment to make on the minutes? No, I think you just got your hand up. Jackie,
No,
can you put your hand down?
No, thank you.
Till we get you to speak. Thank you. Are you happy for me to sign the minutes? If you're not happy, put your hand up. If you don't put your hand up, I will assume that you're happy for me to sign the minutes electronically. I see no hands, so I will sign those electronically. We have no deputations as such, but Councillor Jackie Porter has requested to speak, and I would ask her to do so just before we get to item 6 on the agenda. Councillor Porter.
Thank you, Chairman. And I've just come here in the pouring rain, so I've no idea what, if I look rather wet. I'm speaking here in my role as a Can you hear? Yeah. I'm speaking here in my role as a Cabinet Member for Wellbeing at Winchester City Council, but also as a County Councillor, because this issue has arisen in my own division. I'd like to be seeking clarity from this engagement board on the role of the Director of Public Health in the safety advisory groups, which are held to assess the safety of events as they apply for a licence. The issue has arisen, particularly about fun fairs. These travel around the area and have been subject to safety advisory group scrutiny. I'm aware that the Director of Public Health gave a blanket comment about fun fairs, but actually it's left to the local licensing authority to make the decision, although I understand it's the Director of Public Health that would place the ultimate ban on that happening. And it's obviously in the days as we're all struggling with the expense of working within the COVID world, this actually adds to the workload at both ends, I would suggest. And I'm trying to find a way through this, that the Safety Advisory Group, the COVID aspect of the Safety Advisory Group is included within that work, so that the Director of Public Health can make that directive at that time rather than it going back to the licensing department. This is going to happen increasingly as we get towards Christmas and into the new year. And I wanted to try and seek clarity so that we know exactly where we are with this issue.
Thank you, Councillor Porter. I'm certain that we will cover that item when the Director of Public Health speaks. Before we move on to item 6, I should just make a few opening remarks. I don't have any specific announcements to make, but obviously you are aware that over the last, well, it must be about 48 hours now, the actual numbers that have been tested as positive with the pandemic has gone up because of a significant number that were missed off the totals nationally. And I understand that's affected Hampshire to the extent that there are 162 more cases than we'd originally anticipated. I think this was over a period of a week, but the figures that I think I'm right in saying Simon Bryant will give us will include the additional figures as a result of this correction that had to be made nationally. Beyond that, I think I would just add a comment on Councillor Porter's statement. Yes, we're learning all the time about how best to deal with the different types of public activity to take place, how they relate to the national guidelines as to what can and cannot take place, how these events can take place, and hopefully a degree of consistency across the county and indeed across the region. But this is difficult, bearing in mind this is a moving picture, and what we're allowed to do nationally changes quite rapidly. And of course, there is the additional issue of some areas of the country being in some form of lockdown following different rules. However, having said all that, I think we'll now pass straight on to the Outbreak Control Position Report, which is given to us by the Director of Public Health, Simon Bryant. Simon, over to you.
Many thanks, Leader. Let me share the latest information. If I can get the right one up. Sorry, just bear with me as my screen's now frozen. Let me talk you through the presentation first of all, and then we can go on to any questions. So in the last week, we've had 258 cases, and that brings our total to 6,251. And that's a 7-day rate of 18.7. And as the leader pointed out, that does include those cases that were left off the test and trace service. So our rate of 18.7 per 100,000 last 7 days is below the South East rate of 24.2 and the England rate of 80.5. So in that sense, we are doing very well. We are seeing an increase in cases week on week as we are nationally, and we are, as we can see, we're below the national rate, but that is concerning. And we are monitoring that very, very carefully to kind of take any actions that's required. It's also worth saying, and just for noting, that with regards to the northwest of England, they have a rate of 213 for the last 7 days. So in comparison, we're doing incredibly well there. But it is also just, yeah, as I said, worth noting that these figures are going up, and yeah, that means we just need to keep an eye on that and do some really careful work there. I'm extremely sorry that I'm having trouble sharing this presentation, so I'll just talk it through. So what we're seeing is the epidemic curve that has had the peak back in April, and we're seeing those cases rise, bearing in mind that we've got a different testing regime now, but we are testing more people. There is still a challenge with the testing regime that we have. However, we are seeing that increase in COVID infections increasing, meaning we need to kind of further comply with the social distancing and the other measures. When we look at that by districts, we have seen an increase in all districts, bearing in mind that some districts at the beginning of the pandemic, when we look at the cumulative rate, did testing more quickly. So some districts have had more cases, and we are making sure that we look at those. They've all had, as it were, an uptick in cases in the last few weeks. So we're seeing where they are and looking at those really closely. And we know that the highest infection rate has been in Rushmore, where there was a greater and average infection rates than England across the whole of the pandemic. So we're just looking at that and seeing what we need to do. And with Rushmore being closest to London, we're keeping a close eye on that, because we know from the last wave that the infections came out from London. We saw that in kind of a ring approach. So when we're looking at that across the latest week 39, we know that across the country, most places are now having cases of between 15 to 29 per 100,000, with our colleagues on the Isle of Wight being the one area that's got a very low number of cases and rates. So that's so we're in, but across Hampshire we do very well. Again, we're showing some really good figures there in terms of our rate, but it is going up. I just finally mentioned the excess deaths, which are really, really important to understand. We're beginning to see excess deaths rising slightly, and we've had 3 COVID deaths in the last week. So we're beginning to see that creep up again, where we've had a number of weeks with no COVID deaths. So that's where COVID is mentioned on the death certificate. So again, as I say, it's the picture where we have increasing cases, and we are thinking about how we can manage that and mitigate that in line with how we support the increase in Hampshire. Bearing in mind it's lower than England, but it's still important to make that move forward. Thank you, and thank you for your share. Thank you, Sophie, for sharing that. I'll stop there and take questions. You're muted, Councillor Manns.
Sorry. Questions for Simon. Ken.
Thank you. I mean, I know that Rushmore is closest to London, but is there anything specific among its population that would give rise to such a huge differentiation between that and some of the other areas within Hampshire? And if there is, what are we doing to communicate that, not just with Rushmore, but with those communities that might be wider affected?
I absolutely agree, Councillor Rattigan. So there's a couple of things. We know that the ethnic diversity of Rushmore is more ethnically diverse than other parts of the county, and we know that we've seen from the first wave that those communities who are more ethnically diverse may be further impacted by COVID. So we're working with our comms and insight team to work really carefully to understand what we can do to communicate the messages really appropriately to different communities, to ensure that they can understand them, and also that they mean something. And we know different channels for young people and older people, and so we're doing all that work to ensure that our communication messages are really, really clear for all communities across Hampshire. As I said, we are seeing an increase in cases across Hampshire, which we want to prevent as much as we can, And as you can see from that graph, Rushmore being the one that we are keeping a close eye on because of its proximity to London and the ethnic diversity.
Judy.
Thank you, Simon. As usual, that was exceedingly helpful. Can I just ask, the excess deaths, you said that they've risen slightly from what we'd normally see at this time of the year. Do we know any reasons why, or is it just a statistical blip? I
think we're now beginning to see more deaths from COVID. As I said, there was 3 in the last week, which and there'll be other reasons that we need to investigate in the longer term, which may be due to delayed treatments, which is I suspect what you're suggesting or asking. We are doing that piece of work to really understand that, and we just need to do that over a longer period of time to make sure that what we're not seeing is a kind of a concertina of deaths coming earlier rather than actually. And someone dying earlier than they would have done normally isn't right, but we just need to understand in the long term.
Yeah, that's right. Yes, that's what I was asking, but I didn't know if flu had any impact. We're seeing any flu impact yet on death?
Not yet, no.
No, fine. Okay, thank you.
Keith.
A couple of comments, if I can, Chairman. Firstly, is on the excess deaths again. I'd taken as a view, and I just welcome Simon's comments on this because it was an unscientific view, but it was just based on sort of basic laws of probability, that some of the drop in excess deaths that we saw during the summer was probably more likely to be due to deaths that had happened as a result of the pandemic, effectively in people who were already seriously ill who would have died during the summer period, and therefore you were seeing some balancing come back into effect as a result of that. But clearly, that wouldn't be the case now if we're now seeing a slight increase, even though it is only a slight increase. And I just wonder whether, and we probably don't really have the information because there wasn't testing back that far, whether early deaths are any indicator at all, or excess deaths are any other indicator we can take at all, either in regard to spread of infection or people who are not being tested.
So your first question is easier for me to answer. So let's start with that one. You're absolutely right, Councillor House. I suspect that the deaths may have been brought a little bit earlier, as I was saying to Judy, and that's why there was less deaths in those kind of summer months, because they had sadly been brought a little bit early. So, but as I said, we need to just make sure we look at that over a longer period of time, just to make sure that there's nothing kind of evening out there going forward. With regard to using deaths as kind of a measure of infection, we do know that people who went to hospital, which is where the majority, and in care homes, were being tested. So the places where we were seeing infection, there was testing. We are now having more community testing, where we're seeing more milder cases, people less likely to die. Deaths is a really important measure, but it's a bit of a lag from infection. So it takes place 2 to 3 weeks later. So it does help us understand that. And we also know those who are seriously ill now will get to hospital and they will be tested in hospital, because that's, sorry, in technical terms, that's a different pillar of testing to the testing that's being restricted in capacity. So you would hope that we could test those as well.
Thank you.
Ken, did you have another question?
Yes, thank you, Chair. Very briefly, I mean, the local context is the most important thing to the people who live in an area, and therefore when there is spikes or rises within the infection rate, they are rightly concerned about. Will you add some more local context to some of the commentary that you give, so as councillors or individuals closest to the ground, like GPs and things like that, have got an opportunity to share it, but also to give the reasonings behind it if there is substantive reasons for that spike?
So what we're seeing is community spread. So what I mean by that is cases in the community that we can't necessarily connect to a situation or a setting or an outbreak. So we are just seeing a general rise in cases because that's how the infection spreads. Some people will catch it from someone they don't know who's got it or who's then symptomatic. So that's what we're seeing. We are also seeing an increased number of cases, as you'll be fully aware, in education settings, not outbreaks, but cases. And we're looking at that. And we're also carefully monitoring care homes when we're getting sporadic outbreaks in care, not to the extent we had earlier on, but still. So it's mainly community spread is what we're seeing. households or individuals, and we look at the data every day and we map that data really carefully. It's really sensitive data, but that's what we're seeing. Nothing particular about a setting, a community. We do know, as I think I mentioned previously, we've seen it in younger people, rather than the older population that was impacted on the first wave. However, that age is beginning to rise.
Keith.
Yes, sorry, I got so wrapped up in my first point, I forgot the second point. It's an age thing, I guess. The incidence of flu, and Judy touched on flu, if we look at the experience of the Southern Hemisphere during the course of the last 6 months and the Southern Hemisphere's winter, the incidence of flu was way down compared to almost any year in recent decades. And the theory, I think, behind that is that social distancing and general people's cleanliness and washing hands and all the rest had the effect of suppressing flu in exactly the same way that social distancing has suppressed coronavirus. Firstly, clearly there's some lessons we can learn there about suppressing flu for the future in general public health. But if the experience of the Southern Hemisphere is anything to go by, the logic would be that we will see significantly fewer flu deaths this year, regardless of vaccination or for flu, and therefore we ought to be thinking about how we measure excess deaths again in a slightly different way, because we should almost be subtracting the normal flu curve from the death curve if we get a true measure of how everything else is happening. I know there's sort of inverse logic to that, but again, it's probably far too complex at this stage because we really don't know and we're speculating. But is there anything that you can add on that, Simon?
Yes, if I kind of take that through step by step. So you're absolutely right. The social distance measure, the really good hand hygiene, and those measures we put in place will help prevent flu spread as much as coronavirus. And that's really important because we want to make sure that we prevent both of those illnesses, not least because they're not nice illnesses. They're quite difficult to tell apart at stages, so actually people don't know what they've got. You could find that someone ends up catching both. That could be really tricky and really complex to treat. So all those things mean we do want to manage both, which is why we're really pushing the flu campaign this year. And we don't want the NHS to be overwhelmed with lots of sick people with whatever respiratory disease they've got. With regard to excess deaths, you're absolutely right. We need to look at excess deaths in the round and say, actually, during a winter period, what is the excess deaths that what's the death rate we normally see? So we'll do it seasonally to make sure we understand that. We do want to kind of think about winter. We have what we call the excess winter deaths. So we see more deaths in winter anyway. So we look at that and say, is this over that level? So we do a lot of complex analysis. And I think, as I was saying to Judy, we'll need to do that over a number of months to see actually what's happened over the year, to see, as you said earlier, have people died a few months earlier than they perhaps would have done because they were ill anyway, or have they died much earlier? So we need to look at all those factors, and we'll be doing that work. We're doing it all the time, but we'll kind of do an analysis at the appropriate moment. And I know that Graham's also doing a piece of work looking at that in care homes to make sure we look at different settings.
Yeah, perhaps I could just add something to that. I would have thought this year's statistics should be treated rather like this year's A-level results. In other words, not used for any 5-year comparison, because you pointed out, I hadn't thought about it, but what you said, Keith, I think is absolutely right in terms of the knock-on effect on other ways of people dying, such as through flu, because of the precautions they've taken for COVID-19, which is obviously having a rather odd effect on the figures, I would have thought. So I probably would have thought that when you're looking at 5-year averages, you just take out this year. You may have to take out next year as well in order to get a more accurate indication of what COVID-19 is doing compared with an average year of deaths during the winter and the summer. The other point I was going to make is that I'm rather interested in trying to find a more sophisticated way of measuring. First of all, we're measuring more, we're testing more people, so we're getting more cases. Hospital admissions, I just don't know whether they're taking place earlier than they would have done at the outbreak, or rather later in the period of the disease, if you see my point. than they were in the spring. The sort of average time that people are staying in hospital, and whether there's been any change. Well, I'm certain there has been some change to the treatment they're receiving in hospital. Like I think I'm right in saying, Simon, fewer people are being put on complete respirators. More of them are just being given help with their breathing over and above the partial pressure of oxygen.
There's a number of things there, and I'm not quite sure about the treatment regimes changing. There's obviously some new drugs that we found that are helping to improve people's health, so that's really, really positive. I'm not aware of the thresholds changing for admissions. So actually what you should find is if someone who needs hospital admissions in the first wave will also need it now and should get it. And I think that I was fully aware that particularly before testing was fully implemented, people saying, what do I do if I'm getting sicker? Well, what do you normally do if you're getting sicker? You go to your GP and then you go to hospital if you need it. So we still need to encourage that message that actually the hospital is there to treat you if you need it, if you're not getting better. And you're right, we need to kind of understand that. So if people are in hospital a little bit less, that's good because they get out and they're getting better. And we are beginning to monitor again the number of people going to hospital and then how long they're staying in. It's not almost the number of people going in is one factor, but if they're staying for 3 weeks, actually that occupies the bed and eventually 3 weeks, and that means that it's not used for someone else. So how do we kind of look at all those data? So we're looking at that in this second wave as well.
Thanks, Simon. Any more questions for Simon before we go on to item 7? Okay, and you're doing a verbal report. Oh, Patricia, yeah. Did you have a question?
Yes, Simon, you mentioned earlier today that the number of cases amongst our schools was on the increase, but it was by no means at this moment in time any case for panicking. I just wondered, have we been able to identify whether those cases were of the teaching or ancillary staff? What proportion were of the adult side of the schools, and what proportion were of the school-aged children? Do we know?
I can feed that back to you afterwards, Councillor Starlight. We are looking at that, so we do know if it's a pupil or if it's a member of staff or ancillary staff. We're seeing single cases in schools, so we're not seeing outbreaks. We have had one situation where there's been more than one case, and we are then closing the bubble as appropriate, depending on the situation. I think, as we mentioned previously, if it's a primary school, often that's quite simple. You might close a bubble or a partial bubble. Secondary school, it's much more complicated. And obviously, if there's a teacher that has, in a secondary school particularly, that has tested positive, they may have taught a number of pupils. They have a number of measures in place, and for example, they'll have lots of schools have markings on the floor where the teacher can't leave without a mask. So they're trying to manage all of those things really carefully, but we are looking very closely to see if it's the adult or the pupil, and nothing particularly stands out. It's a range of different people who are testing positive and then requiring action to be taken.
All right. Will you let me have that information? Thank you very much. Thank you.
Okay. Right. Well, let's move on to item 7, Simon, where you're going to give us a verbal update. And obviously you'll probably want to, as I know you have with me, commented on Councillor Porter's observation about fun fairs and the like.
Yes, I thought, I know we had an informal briefing last week, but just to formally note, we did issue our first legal direction last Friday for the closure of the fairy festival that would have taken place in the New Forest. So just to note that, and there was a variety of reasons we did that. It was a large event. There was an alcoholic bar, and there was a number of people and different things. So we took really careful consideration working with the legal team to ensure that we understood that legal direction very carefully and considered, and we did that. So it's just worth note if we could note that here. And just if I move on to Councillor Porter's point about the safety advisory groups, the SAGs, and how we're working with that, and Laura Taylor may want to comment as Chief Executive of Winchester. We are working really closely with the safety advisory groups to ensure that they have the right input from public health in terms of COVID safety. Now, we work with the safety advisory groups anyway, but COVID safety is particularly needed at this point in time. It's a very complicated process in terms of asking an event, and not all events are licensed, so they won't all go through a SAG. So it's quite a, we're working with the system we have, but that's where we are. And we advise them on different things such as the cleaning regime they should have, the number of people, how the people should get in and out, how they should queue, how they should social distance. So we're picking up a number of those issues. And as Councillor Porter said, a number of fun fairs have come forward. The Showman's Guild has given some really clear advice on what fun fairs should do, how they restrict numbers, how they should clean, and all those things. So most fun fairs are in line with that, and if they're not, we work with the safety advisory group to ensure that the guidance given is clear. We're also working across, and obviously we have 11 safety advisory groups, but working with our unitary colleagues as well to give some consistent advice on all sorts of different events. As you know, Councillor Porter said, it's quite difficult if a fun fair doesn't know or an event doesn't know because it's slightly different. So we're working really closely to ensure that the guidance is clear, and we're also trying to work across the southeast of England to make sure at this stage of the pandemic, for our setting, which isn't in local lockdown or an area of concern, that actually we manage that really, really carefully and we give the right advice. We're also working with a number of other bodies, so there'll be UK Athletics, there'll be the Football Association, a number of different kind of associations we're working with where they've given guidance and then we have to work locally. And that is working well. It is very complicated due to the nature and the difference of different events and how we need to localise that. But that's going well, and that's the kind of advice we're giving, working really well with our environmental health colleagues in the districts and the licensing colleagues in the districts. I see John wants to come in. I don't know if Laura wanted to add anything.
John, did you want to say something?
If I may, please, Leader, because I think it's only fair to come in behind Simon on that point, and also to pick up a specific issue that I think Councillor Porter quite rightly raised. Because going back to the events leading up to our first direction, the Health Protection Board, with me as party to it, had issued a signal, I think it's best to call it a signal, that we thought fun fairs were likely to be captured by our sense of what would be above the threshold for allowable events. And indeed, when we went into session on the Friday, during which, as Simon has referred, we cancelled or issued a direction to ensure the cancellation of the festival that he's referred to, we went into that session expecting to come out with the same result with regard to the fun fair that was taking place at Eastleigh. It's only when we look more closely at the legal advice and our understanding of the safety measures that have been put in place by the fun fair at Easter, which Simon's just alluded to in terms of individual risk assessments, that we realised that we were falling short. Firstly, we were falling short of what we thought were the right thresholds to require a direction, or that a direction would require. And also, in fairness to the arguments being put to us by the fun fair organisers, if you laid across the same stipulations that we were applying to the fun fair, it would have implications for other sectors of the retail economy, and we had to treat that matter fairly. So that's why we came to the conclusion that we couldn't reach the level of a direction to close the fun fair, but we did issue statement saying that we would prefer fun fairs not to take place. Where they did take place, in partnership with district authorities, we would ensure that they were monitored very closely indeed, and indeed to follow the example of Southampton City Council, we would probably not allow such events to take place on council-owned land. But we fell short of the direction for the reasons I've just stipulated. And I think that was it's a complicated, nuanced, but fair position, which will, I'm afraid, require risk assessment on a case-by-case basis as we go forward, unless indeed, if you like, a notion of precedent establishes that those events are cancelled. But if they are, they could have implications for enclosed retail sectors as well in some respects, such as arcades and the like. So that's the position we reached, Leader.
Thank you. Laura.
Thank you very much, Leader. If I may, The SAG is an absolutely tried and tested and well-respected mechanism to support with event planning, and we roll them successfully across the county. They're a multi-agency approach, as Simon has set out, and are well respected by operators, which is critically important, and works well for all the agencies. And our PHE team has always been possible for it to be engaged in it, and certainly for our large and significant events over the past month, Simon's team has sat with the SAG, and if they're not in the SAG and they've been in more than they've not been in, then they are certainly a consultee. We all know it's a busy season coming forward, and certainly we are holding a lot of SAGs out in the district. They're hosted by the district teams, and our frontline staff, as Simon has mentioned, our EHOs are front and centre of that. But there are other teams that are surprisingly engaged. Depending on where the event is, it will involve our highways team or could involve our open spaces team, and that's an effort between county and districts working in partnership. And those SAGs are very carefully trying to balance whether we can safely operate and protect our community from infection, and the desire to keep things as familiar as possible for our residents. So it's a really carefully balanced and complex set of decision making that the SAGs are making across the county and district boundaries in the face of an ever-changing set of guidance and policy information. So we are trying our very best, but we are certainly all very busy on the amount of events that are coming forward for this autumn-winter period. Thank you, Chairman.
Thank you for that. Councillor Porter, I hope you won't mind if I don't call you at this point, but if there are any other questions that you have based upon what you said in your presentation to the meeting earlier, if you could take them up either with the Chief Executive or indeed Laura in Winchester. And if you're not satisfied, please come back to me, or indeed Simon for that matter, please come back to me. It's just that I just feel that if I allow this precedent at this stage, I'm not quite certain what direction it might go in at future meetings. So I hope you'll bear with me, but do come back next time if you don't feel you've had a satisfactory response. Are we all complete on this item?
Can I just give one final item? Yes. Would that be right, Leader? So just to let the board know, we are working on communications and guidance. As Laura said, there's a number of events coming up in the calendar. So we will work in our Health Protection Board tomorrow to look at those key events, thinking about Remembrance Day, Bonfire Night and Halloween, and all those kind of things coming up there. Slightly, some might be more informal, some are more formal, just to be really clear what our guidance is on that, so that we can plan ahead early and support those in a safe way, rather than having to do last minute. So that's our plan, and I will inform the engagement board of that guidance when it's ready.
So you've very kindly, Simon, jumped ahead to communication engagement update. I think that's you've probably covered that now. Am I right in saying? I
think Councillor Gresky is going to cover a little bit more of that's taken place.
Oh, right. Yes, she is. Sorry. Judith.
Thanks very much. Before we look at the slide, it is just a single slide agenda item, but there's a lot of information on it. I'd just like to say a few words of introduction. Essentially, there are two strands to the comms work that's being done around COVID. The first strand addresses the response activities and local outbreak planning, that is to say, dealing with what's happening now on the ground on as real-time a basis as possible. And the second strand is the comms work on prevention and more general up-to-date messaging to help people stay safe and provide information. Now, the comms actions are guided by the actions that come out of the Health Protection Board, which I think is meeting tomorrow, this local outbreak engagement board, analysis of the data, and the national priorities and engagement activities. I'm sure you've all seen the Keep Hampshire Safe graphic, which is being shared with and promoted by the district councils and personalised for them. For instance, Keep Gosport Safe, Keep Fareham Safe. And it's great that most councils are using that to capitalise on the power of the continuity of branding in getting the message across. Responsibility for outbreak control lies with the County Council, but also involves the Local Resilience Forum, So it's important that we also join up our communications across the piece wherever we can. Not just the local resilience forum, but obviously Hampshire Fire and Rescue and the police and so on and so forth. Now, Comms have issued a huge number of press releases to the local media, and we've been engaging with people on social media, where there's a combination of organic activity on things like Facebook, Twitter, Instagram and Snapchat, and importantly, paid for targeted messaging. Now, most of you won't see this activity because it's below line and it's specifically aimed at 5 sections of the community. And those 5 sections are the Black, Asian and minority ethnic groups, the young people aged 18 to 24, single parents, the working community, and fifthly, older people. And high-risk settings are being supported with different types of communications working through a governance structure, for instance, via adult social care for more appropriate and effective messaging to care homes and domiciliary care providers. There are also a number of aligned campaigns focusing on flu vaccination, the helpline for the vulnerable, sustainable travel and active travel to school, to name just a few. And parish councils can also play their part. The county council is sending, I think it's a weekly email update to HALC, the Hampshire Association of Local Councils, for dissemination to parish councils. So turning to the slide, I think you've probably all had a chance to have a look at it since it was sent out yesterday. I'm not going to read it all out in full because it's in the agenda, but I will pick out some highlights. So if we look at, I'm just getting it in front of me here, if we look at the first third, that's the left-hand side third of the slide, it gives a summary of the social media activity and reach. So with 78 posts, we're reaching almost 630,000 people, with the data dashboard being the most successful post. And some of the posts are animations, and there was also a video targeted at the BAME population. The centre of the page, if we can just move along to that, summarises the stakeholder and public engagement. And you can see the key areas of inquiry to the County Council related to schools, testing, local restrictions and so on, as mentioned there. Just in September, there were 76 media inquiries handled, and 99% of the media coverage in over 100 news items was positive. The County Council COVID-19 web pages are constantly refreshed and had 61,000 views last month. And you can see the Hampshire Safe graphic sign there, right at the bottom of the middle section, the graphic that I referred to earlier. I mentioned in my introduction, moving across to the right-hand side of the page, high-risk settings. And you can see the support that is being provided specifically for schools, local businesses and adult social care providers. And again, I'm not going to read it all out, but I'll just pick out 2 things. Firstly, keeping schools safe so children can continue their education is hugely important. And you can see there that we've held more than 20 outbreak planning webinars for schools and other educational settings, and produced a video to reassure parents regarding the safety of their children in early years settings. Secondly, there's a new fortnightly COVID alert newsletter being sent to more than 2,000 adult social care providers across the county. Finally, I just want to place on record my thanks to the County Council's comms team in public health and the comms teams in other departments who've all been working incredibly hard. They all know who they are. Who knows, they might even be watching us this afternoon. But they've been working flat out throughout the pandemic. So a big thank you to them. If there are any questions, then Simon and I will try to answer them. Thank you.
Judith, thank you very much indeed. Have we sent that excellent diagram that you've just commented on to Maria Miller? I think we have, because if we haven't, it might be just worth sending it to her.
If it hasn't gone, it will go.
Yeah.
Chairman, questions? If I may, it's gone to all MPs and we're monitoring its update.
I thought
Thank you.
Yes. Any other comments? I've really only got one thing to say, and that is that clearly we've got a number of events coming up in the next few months. Obviously, Remembrance Sunday and Remembrance Day itself on the 11th, which is a Wednesday. And although I would like in an ideal world to have a sort of national guideline already with us, we haven't got it yet. I know the British Legion in association with Remembrance Day are well up and running with their advice. I think all we're going to do is give some sort of general advice in terms of these events can go ahead provided the normal distancing rules and numbers apply, i.e. 6 and 2 meters. And indeed, in terms of church services, the normal church service rules should apply as well. But I think I'm right in saying, Simon, we're going to produce something this week along those lines, although increasingly it's being overtaken by what people like the British Legion are doing anyway.
Absolutely. We're working through with the British Legion, with the diocese, to make sure that we've got some really clear guidance that we would expect people to follow.
The main thing is to try to ensure that we've given uniform advice, because what is it? We've got 250 parishes. The majority of those will have some way of commemorating on the world wars, the 2 main world wars, on the 11th, if not the church service the weekend before. Patricia.
Thank you. Really, it's a request, I guess, to Simon. That presentation slide which Judith spoke to just now on the communications that we've had for CV19, COVID-19, rather, is it not possible to send that not only to Maria Miller, but indeed to all our Hampshire MPs? Because I know that I would like my MP to get a copy of it, definitely.
We've done so.
It's already happened.
We've done so.
Yeah.
Oh, fine, thank you.
Well, we're going to do so now. We're going to do so now on a very regular basis.
Oh, that's brilliant.
What we've really discovered is, although we've had a lot of information going out, I think we've almost been given too much to our MPs, and it hasn't really sunk in. They're not picking out the important stuff. So that's an attempt to send something that's really focused, which they're likely to read.
Good idea. Excellent. Thank you.
Okay. Has anyone got anything else before we finish? Okay. Right. Well, we may well have another briefing before our next meeting, which is, we got a date for the next meeting. I think we have, actually. I can find it.
Chairman, it's November 2nd at 2 p.m.
That's right, yes. We may well have another briefing before then, because, as I've said before, what's important is to keep up with what's going on with the pandemic. Anyway, thank you all very much, and see you on the 2nd, if not before.